Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is the February CEO Connection. With me today is Stephanie Wade, and Stephanie is our Employee of the Year for 2015. Stephanie has been with us some 12 years and has served in different capacities in the hospital, in different areas in the clinical care arena. Many of you know Stephanie from her participation in the ACE initiatives that we do each year, and Stephanie has been involved in it for 2 years. I've known Stephanie for a long time. I think originally I became acquainted through her musical talents. She and her husband have a band that they play on, and it's always real fun to listen to them. And for those of you that know her, and those who don't know Stephanie, she's just a delightful person and really well deserved of getting this recognition. So Stephanie, tell me a little bit about your time you've been at White River, and what do you think you did to deserve this recognition?
Well, I've been at White River. I started here back in 2003. I guess, like you said, I've been here about 12 years. Mm-hmm. Worked med-surg for a couple of years, surgery for around 7, and now I've been in OB for about 3. As far as deserving, everybody I work with I feel deserves this, but I really truly care not only about our patients, I care about all our employees, and I feel like we are a wonderful family here, and I'd go out of my way to bring a smile to everybody I meet. I do that 10-5 rule, if anyone knows what that is.
No, what is that 10-5
That
rule?
10-5 rule, I tell you, that is wonderful. 10 feet away, you greet them with a smile. 5 feet away, you not only a smile, but you acknowledge them. Say, good morning. Hey, how are you today? So I go out of my way to do that, try to make everyone feel welcome and brighten their day.
Well, that's real apparent. It's particularly when you're around grouches like me, it's kind of nice to have people like you to kind of balance.
I try. I go by your window and wave at you, try to bring a smile. So.
Well, I appreciate you doing that.
Thank you.
How about some of the doctors you worked with over the years? I know that you worked in surgery.
Yes.
I think you told me that you worked principally in orthopedics.
Yes, really worked a lot in orthopedics. Went to several conferences to build my skill level. Worked a lot with Dr. Allen, Dr. Angel, Dr. Grammer when he was here. Mm-hmm. Was able to care for a lot of people.
We were really fortunate at White River to have the surgical skills, not only the physicians, but just all the staff that we have with us.
Yes, we do.
And so your background really worked well to go up into obstetrics.
Yes, it did.
What actually do you do in obstetrics?
Oh, you name it, I do it. I take care of moms and babies, take care of our people that come in that are in labor or not in labor having problems, take care of the newborns when they get here. Also, we take care of our surgical patient, women's unit. We do a lot of that, women's surgeries, just anything that they need. Mm-hmm. And sometimes we float to other parts of the hospital, so we're not just limited there. We get to care for every aspect of health. Mm-hmm.
You were selected out of really 12 great applicants this last year. We have a committee who's responsible for picking the employees of the month.
Yes. And
then we put the vote out at the end of the year to all the employees in the hospital to select the employees of the year. So it's a great testimony for you and that you got selected. So it wasn't just not just by a few people, but for the entire staff. So
well, I do appreciate it. It is a great honor.
And you get to park close to the hospital?
Oh, yes, I do. I've got a wonderful parking place. If you ever want to use it, just check my schedule. If I'm not here, feel free.
Okay, well, I'll keep that in mind. You never know, I might just do that. So, well, thanks for coming and spending the time with me today, and congratulations.
Thank you very much.
I'm so proud for you.
Thank you.
The standard of the month is environmental focus, and that is for us to strive to provide a calm, healing, safe, clean, and hazard-free environment. I'm a real stickler for the cleanliness of the hospital, and I think you'll find me oftentimes picking up papers that have been left on the floors, or just clean up around to make the place better. So I'd really encourage you to do similar types of things, because so much of first impressions are made by just what the appearance of the facilities are when people join us or come visit us. I notice on the floors that we have quiet times during the day, and the times I'm on the nursing units where there's quiet times, I can really tell a calming atmosphere that is conducive to healing and just rest. And so during this month of February, let's focus in on the environment and see what we can do to make it a better place, not only from a cleanliness and appearance perspective, but a better place from a healing environment as well. So standard of the month, environmental focus. We got two great employees of the month. First one being Julie Eddings, who's an RN at Stone County Medical Center. Julie has been at Stone County Medical Center for 13 years, and I've known Julie from past times over there, and she's really a great employee. And so please be sure to recognize her for that selection. At White River Medical Center, we have Erin Beth Hayes, and as is often the case, her name comes up repeatedly for recognition, and so we're really pleased to have her be selected. She's been here some 6.5 years working in pharmacy, and really well deserved of being recognized again this month. So when you see Erin Beth, be sure to congratulate her and recognize her as well. We've had a change in providers at our Cave City clinic, and Kay Plumley is now serving as our APRN at the Cave City clinic. Kay has been APRN for some 22 years, and for the most part of that, she's worked with Dr. T.M. Young at our medical complex in the Hardy area. Kay is well known for her skills in taking care of patients, and just really a great person to be around. So if in Cave City you want to stop and congratulate Kay on her new responsibilities. We've had a couple of changes in leadership in the director level at White River Medical Center. Hope Caraway is now our Director of Human Resources. Hope has worked with us for some time, and previously she was the Assistant Director of Human Resources. So Hope has now taken responsibility for Human Resources, and I know that she's going to do us a great job. Robin Sweet is now a Clinical Director and responsible for some of our rural health clinics. Robin has been with us for a lot of years, and most notably she's worked as a provider at our Strawberry Clinic. And so Robin has left the clinic setting as a provider and is now providing as a manager in charge of some of the clinics. So when you see Robin, be sure to congratulate her on her new appointment as well. Each month we hold a community education event at White River Medical Center in our conference room. On February 9th, Dr. E.J. Jones will make a presentation on menopause. And so if available, I hope you'll come and hear Dr. Jones speak. It's at noon in the conference center, and I know you'll really benefit from the speech that Dr. Jones has prepared and will present at that time. I'm pleased to inform you that we have implemented online bill pay on the whiteriverhealthsystem.com webpage. It really provides a more convenient way for patients and, well, any of us to pay our bills. And so, let others know about it and avail yourselves of that new services as well. In January, we had a Leadership Development Institute that was held at the UACCB. For 2 days, the leadership of White River Medical Center was off-site, and we had the opportunity to learn some new techniques and improved techniques on how we do a better job of leading and interacting with staff and ourselves. And so we do that every 6 months, and the end result is that we're better. We become better at this, and hopefully we can make everybody's jobs improved as well, and make us as a hospital, just make us better. So I hope that your leader has talked to you a bit about some of the things we learned and applying those new talents to make our work environment better. So, and again, we'll do that again in about 6 more months. This concludes my February CEO Connection. Thanks for watching, and if you have any suggestions how we can make it better, be sure to let us know. So thanks, and have a good month.